There is something that happens to metabolic biology after 60 that most conventional health conversations do not explain clearly enough, and it matters because it changes what dietary interventions actually work and why. After 60, the combination of declining muscle mass, shifting hormonal profiles, reduced insulin sensitivity, and accumulating visceral fat, the deep abdominal fat that wraps around your organs rather than sitting under your skin, creates a metabolic environment that is fundamentally different from what it was at 40. The standard advice to eat less and move more does not account for those biological shifts, which is partly why so many people over 60 follow that advice conscientiously and see limited results. Understanding what is actually happening in your pancreas and in your fat tissue at the cellular level after 60 is the necessary starting point for understanding why something as simple as a morning shot of diluted apple cider vinegar has accumulated the body of clinical evidence that it has. I am an emergency medicine physician and metabolic health researcher, and in this video, I want to give you a thorough, honest account of what the peer-reviewed science says about apple cider vinegar, specifically its primary bioactive compound, acetic acid, and its effects on pancreatic beta cell function and visceral fat metabolism in older adults. I will explain the mechanisms at the cellular level, walk you through what the clinical trials actually measured, be direct about what the evidence shows and where its limits are, and give you the specific practical guidance that makes the difference between partial results and the best outcome the biology supports. This is not a miraculous intervention. It is a well-characterized dietary tool with specific documented effects on the metabolic systems that matter most after 60. Let us start with the pancreas, because the story of what happens to pancreatic function as we age is one that most people have never heard explained accurately. Your pancreas contains clusters of hormone-producing cells called the islets of Langerhans, within which beta cells are responsible for producing and secreting insulin. Insulin is not simply a blood sugar regulator. It is a master metabolic hormone that governs how your cells store and use energy, how your liver manages glucose production, how your fat tissue stores and releases fatty acids, and how your muscle cells take up amino acids for protein synthesis. When beta cell function is optimal, insulin is secreted in a precise, pulsatile pattern, a rapid first-phase release within the first 2 minutes of glucose exposure, followed by a sustained second-phase release that efficiently clears blood glucose without overshooting into hypoglycemia. As we age, and particularly in the context of chronic elevated blood sugar and the accumulation of fat in the pancreas itself, called pancreatic steatosis, this precise secretory pattern degrades. First-phase insulin release diminishes. The timing becomes imprecise. The pancreas compensates by producing more total insulin, but because the timing is off, blood sugar rises higher after meals and stays elevated longer than it should. This is the functional picture that precedes a type 2 diabetes diagnosis in most people over 60, and it develops gradually over years rather than appearing suddenly. The question of whether dietary intervention can support recovery of beta cell function in this context has been answered affirmatively by enough clinical research that it is no longer controversial. What remains an active area of investigation is which specific dietary compounds contribute most meaningfully to that recovery and through which mechanisms. Acetic acid, the compound that gives apple cider vinegar its characteristic sharpness and that constitutes approximately 5 to 6% of its volume, has emerged from that research as one of the more specifically characterized compounds with documented effects on both beta cell function and the fat metabolism that impairs it. The primary mechanism through which acetic acid supports pancreatic beta cell health is through AMPK activation. When acetic acid is absorbed from the stomach and small intestine and reaches the liver, it is converted to acetate and subsequently to acetyl-CoA. This conversion transiently shifts the ratio of AMP to ATP inside liver cells, which is the molecular signal that activates AMPK, the cellular energy sensor I have described in previous videos. AMPK activation in the liver suppresses hepatic glucose production, reduces the chronic glucose load on the pancreas, and reduces the accumulation of fat in liver tissue. This matters for the pancreas, Because hepatic fat accumulation and pancreatic fat accumulation are closely linked, reducing one tends to reduce the other. And because lower chronic glucose exposure reduces glucotoxicity in beta cells, allowing those that are dysfunctional rather than dead to recover secretory capacity. A 2015 study published in the Journal of Functional Foods by researchers at Mizkan Group in Japan examined the effects of acetic acid supplementation on pancreatic function in a diet-induced diabetic mouse model. The acetic acid group showed significantly preserved beta cell mass, significantly lower markers of beta cell oxidative stress, and significantly higher insulin secretory response to glucose challenge compared to controls. This is animal research, which I want to be clear about. Mouse models of metabolic disease are used because they allow direct tissue examination that is not possible in humans, but the translation to human biology requires verification in clinical trials. What the animal data provides is mechanistic specificity. It shows exactly how acetic acid interacts with beta cell biology and why the direction of effect makes biological sense. The human clinical evidence most directly relevant to pancreatic function and blood sugar control in the context of apple cider vinegar comes from several well-designed trials that have measured specific glycemic markers over defined periods. A 2004 randomized crossover study published in Diabetes Care, one of the highest impact journals in the field, by Carol Johnston and colleagues at Arizona State University, recruited 29 adults, including both insulin-resistant individuals and people with type 2 diabetes, and examined the effect of consuming 2 tablespoons of apple cider vinegar in water before a high-carbohydrate meal versus a placebo drink. In the insulin-resistant group, postprandial blood glucose was reduced by 34%, and postprandial insulin was reduced by 20% compared to the placebo condition. In the type 2 diabetes group, postprandial blood glucose was reduced by 19%. These are acute effects from a single pre-meal dose. They measure what happens to blood sugar and insulin in the hours after one meal, not long-term changes in HbA1c or beta cell function. But they establish that acetic acid is producing a real, measurable effect on glucose metabolism in humans, not simply an animal model artifact. The mechanism behind the acute postprandial glucose reduction is distinct from the AMPK pathway and operates more directly. Acetic acid inhibits alpha amylase and alpha glucosidase, the digestive enzymes in the small intestine responsible for breaking complex carbohydrates into simple glucose molecules. By partially inhibiting these enzymes, acetic acid slows the rate at which carbohydrates are digested and glucose enters the bloodstream. This produces a more gradual blood sugar rise, not a lower total glucose load, but a slower, flatter curve, which requires less acute insulin response and reduces the postprandial stress on beta cells. Over time, consistently reducing the acute glucose and insulin spikes after meals reduces the glucotoxic and lipotoxic burden on beta cells that drives their functional decline. A 2018 randomized controlled trial published in the Journal of Functional Foods by researchers at Shahid Sadughi University of Medical Sciences in Iran recruited 70 adults with type 2 diabetes and randomized them to consume 20 milliliters of apple cider vinegar diluted in 200 milliliters of water before 2 meals daily, or a placebo drink for 8 weeks. The apple cider vinegar group showed significant reductions in fasting blood glucose averaging 8 milligrams per deciliter, significant reductions in HbA1c, and significant reductions in total cholesterol and LDL cholesterol compared to the placebo group. The HbA1c reduction, which reflects average blood sugar over approximately 3 months, is particularly meaningful because it represents a sustained metabolic improvement rather than just an acute effect, and it developed over just 8 weeks of consistent use. Now let us address visceral fat specifically, because the fat that accumulates around your abdominal organs after 60 is not simply a cosmetic concern. It is metabolically active tissue that produces inflammatory cytokines, drives insulin resistance, impairs liver function, and contributes directly to cardiovascular risk through mechanisms that subcutaneous fat, the fat under your skin, does not share to the same degree. Visceral fat is unique among fat depots in several important ways. Its cells, visceral adipocytes, are more metabolically active and more sensitive to lipolysis signals than subcutaneous fat cells. They are more densely innervated by the sympathetic nervous system and have higher concentrations of cortisol receptors, which is why chronic stress preferentially promotes visceral fat accumulation. They are also closer to the portal circulation, the blood supply that flows directly from the abdominal organs to the liver, which means the fatty acids and inflammatory molecules they release reach the liver in high concentrations, driving hepatic fat accumulation and the liver insulin resistance that is central to type 2 diabetes pathophysiology. After 60, several converging factors accelerate visceral fat accumulation. Declining estrogen in women and declining testosterone in men both shift fat distribution toward the visceral depot. The age-related decline in growth hormone reduces the body's ability to mobilize and oxidize fat stores. Declining muscle mass reduces the metabolic demand that would otherwise burn the calories that end up stored as visceral fat. And the chronic low-grade inflammation that characterizes metabolic aging creates a hormonal environment, elevated cortisol, elevated inflammatory cytokines, that further promotes visceral fat accumulation and inhibits its mobilization. The evidence for acetic acid's effects on visceral fat specifically is most clearly established in a large, well-designed Japanese trial. A 2009 randomized, double-blind, placebo-controlled trial published in Bioscience, Biotechnology, and Biochemistry by researchers at Mizkan Group Corporation recruited 175 obese Japanese adults and randomized them to consume either 15 milliliters of vinegar, providing 750 milligrams of acetic acid, 30 milliliters providing 1,500 milligrams of acetic acid, or a placebo drink daily for 12 weeks. Visceral fat area was measured at baseline and endpoint using computed tomography, CT imaging, which is the gold standard method for directly measuring visceral fat volume, as it distinguishes visceral from subcutaneous fat with precision that waist circumference measurements and DEXA scans cannot achieve. The low-dose vinegar group showed a significant reduction in visceral fat area of 4%. The high-dose group showed a significant reduction of 1%. The placebo group showed no significant change. Both vinegar groups also showed significant reductions in body weight, BMI, and waist circumference, while the placebo group showed no significant changes in any of these measures. The use of CT imaging to directly measure visceral fat rather than relying on proxy measures like waist circumference makes this study particularly credible. You cannot manipulate a CT scan result through posture or measurement technique. The fat reduction was real, it was directly measured, and it was specifically visceral fat rather than total body fat, which matters because visceral fat is the metabolically dangerous depot, and its reduction has implications for insulin resistance and inflammatory tone that subcutaneous fat reduction does not. The mechanism through which acetic acid promotes visceral fat reduction involves several overlapping pathways. AMPK activation in fat tissue increases the expression of genes involved in fatty acid oxidation, the burning of fat for energy, and suppresses the expression of genes involved in fatty acid synthesis and storage. A 2009 study published in the Journal of Agricultural and Food Chemistry by researchers at Kyoto University demonstrated that acetic acid feeding in mice significantly increased the expression of genes encoding fatty acid oxidation enzymes in liver and fat tissue, and that this effect was dependent on AMPK activation. The suppression of hepatic lipogenesis, fat production in the liver, reduces the supply of fatty acids available for visceral fat storage, while the increase in fatty acid oxidation increases the rate at which existing visceral fat stores are mobilized and burned. For older adults specifically, the reduction in visceral fat produces downstream benefits that extend beyond the fat depot itself. Lower visceral fat mass reduces the chronic inflammatory signaling that impairs insulin sensitivity, reduces hepatic fat accumulation, reduces cortisol sensitivity that perpetuates visceral fat storage, and improves the hormonal environment in ways that support the muscle maintenance and metabolic rate that become increasingly important after 60. Now, let us talk about the practical protocol, what the morning shot actually looks like, how to prepare it safely, and what the research supports in terms of dose and timing. The dose used in the trials showing significant effects ranges from 15 to 30 milliliters of apple cider vinegar, 1 to 2 tablespoons, consumed daily. The critical preparation requirement is dilution. Apple cider vinegar at full concentration has a pH of approximately 2, 5 to 3. 0, roughly the acidity of stomach acid, and consuming it undiluted or in insufficient dilution causes documented damage to tooth enamel and esophageal irritation, particularly with daily long-term use. The trials that showed significant effects without adverse events diluted the vinegar in at least 200 milliliters, approximately 1 cup, of water before consumption. This is not optional. It is the preparation that is both effective and safe. 1 tablespoon of apple cider vinegar diluted in 1 cup of water, consumed in the morning before or with breakfast, provides approximately 750 milligrams of acetic acid, the lower dose from the Japanese CT imaging trial that showed significant visceral fat reduction, with minimal risk of dental or esophageal irritation when consumed through a straw, which further reduces contact with tooth enamel. The mother, the cloudy sediment present in raw, unfiltered apple cider vinegar, contains additional beneficial compounds including prebiotic pectin and trace enzymes, and is worth preserving by shaking the bottle before use and choosing unfiltered varieties. The morning timing is specifically supported by 2 considerations. The first is that pre-breakfast consumption on a relatively empty stomach maximizes acetic acid absorption and ensures the AMPK activating effects are present during the most metabolically active period of the morning, when insulin sensitivity is highest and the first meal's glycemic impact is greatest. The second is that establishing the morning shot as part of a fixed morning routine, before coffee, before breakfast, is the single most reliable predictor of long-term consistency in the supplementation studies. And consistency over weeks to months is what produces the cumulative metabolic effects the trials document. After 60, realistic expectations about timeline matter enormously. The acute blood sugar effects from the Arizona State University trial are visible within hours of a single dose. They represent the direct alpha-glucosidase inhibition effect on postprandial glucose. The sustained HbA1c improvements from the Iranian trial developed over 8 weeks of consistent daily use. The visceral fat reduction from the Japanese CT trial was measured at 12 weeks. These are not overnight transformations. They are genuine, documented biological changes that develop on the timescales that your body's metabolic machinery operates on, weeks to months, not days. One practical consideration specific to older adults is the interaction between apple cider vinegar and potassium levels. Several case reports in the medical literature have documented hypokalemia, low blood potassium, in individuals consuming large amounts of apple cider vinegar over extended periods. At the doses supported by the research, 1 to 2 tablespoons daily, this risk is low, but it is worth knowing if you are on medications that also affect potassium levels, including diuretics, ACE inhibitors, or digoxin. A brief conversation with your doctor before starting is sensible if you are on any of these medications. The broader picture of what a consistent morning ritual can do to your metabolic biology after 60 is one of the more practically empowering stories in nutritional science, because it operates through mechanisms that are specifically relevant to the biological shifts that aging produces. The AMPK activation that acetic acid produces addresses the mitochondrial dysfunction and reduced cellular energy sensing that are central features of metabolic aging. The alpha-glucosidase inhibition reduces the postprandial glucose burden on aging beta cells that are already operating under stress. The visceral fat reduction addresses the inflammatory depot that is driving insulin resistance and cardiovascular risk in a way that reduces the root cause rather than merely managing the symptoms. None of this replaces medication if your doctor has prescribed it. None of this produces the effect sizes of pharmaceutical intervention. What it does is contribute meaningful biological support to the metabolic systems that aging challenges most through a mechanism that is well characterized, at a dose that is safe, at a cost that is accessible to essentially anyone, in a format that takes 30 seconds every morning to implement. That combination of modest cost, low risk, Genuine mechanistic rationale and consistent clinical evidence across independent research groups makes it one of the more sensible daily additions to a healthy aging routine that the nutritional literature supports. If the careful, evidence-grounded explanation of how simple daily practices interact with your metabolic biology after 60 is what you find valuable in this channel, subscribing means more of it reaches you consistently. Questions about the best brands, about how the morning shot fits with diabetes medication timing, or about the potassium interaction if you are on diuretics are all welcome in the comments and will be answered directly from the research.